What are the possible causes of low back pain? There are a lot of different possible causes of low back pain, but I want to simplify this for you. I'm going to divide it into two main categories of possible causes of low back pain. That way it will be easier for you to understand, and also it will be easier for you to determine how you're going to treat that back pain. So make sure you watch till the end, because I will give you hints or tips on what treatment to do for each. Hi, I'm Reggie from Restore Plus Physical Therapy, and I help people get pain-free and feel alive without pills and medications. And I have been doing so for the past 24 years. If you find value in this video, please give it a thumbs up. It helps a lot. Let's get right into it. Now, as I have mentioned, there are a lot of different possible causes of low back pain, but I don't want to be too technical. So, for simplicity, I want to divide it into two main categories. One is flexion, one is extension. Flexion is if you are slouching. If you like to slouch or you like to slump when you're sitting or standing, that's one group of low back pain. The other one is extension. If you arch your back like this you commonly see in females when they have bigger buttock area, bigger behind, or some of them, they want to have the image of a bigger behind and they arch their back more than what is necessary or more than what is normal. Then that is called the extension. So one is flexion and one is extension. Now to explain that further, I want to use Freddie over here. Now Freddie's spine doesn't move too much, but I hope this will give you a better idea of what's happening to your spine when you're flexing and extending. So when you're, first is, let's discuss flexion. When you're slouching like this. When you're slouching, so you can see here is when I try to bend this forward, you see the space here increases. When this increases, what happens is the disc will come out to the back. And when it comes out to the back, that's what you call a herniated disc. When the disc herniates, there's a possibility that it can hit the nerves. And when it hit the nerves, it can cause symptoms such as pain, tingling, numbness, or even weakness. So that's the first category, is flexion. When you're slouching, the disc comes out to the back and then it's gonna pinch on the nerve. I don't want to oversimplify this, but most back pains can be included in one of those two main categories. Of course, there are other causes of back pain that will not be included in either one of them, but that's not what we're talking about here. Most of the back pains that I have seen falls into one of those two categories. Now, how do you find out which category you fall under? Just keep doing the movement. Meaning, if you are slouching, if you find yourself slouching a lot, try bending more. Try touching your toes, bending forward. If bending forward, touching your toes, putting your pants on, or picking things up from the floor causes more pain or causes the pain to radiate down the leg, then you fall into that flexion category. If you find yourself having that posture that your buttocks or your behind sticking out and have this lower back arch more, you can try this. Try arching backwards. If arching backwards, or typically if standing causes more pain or causes more pain to radiate down the leg, then you fall under that extension category. If you fall on that flexion category, what I want you to do is this. So you have to make sure you listen to this, because this is your bonus tip there. If you fall in that flexion category, meaning you have the space here because you're slouching, it increased, and the disc came out back this way, what you would want to do is you introduce the opposite movement. Introduce extension, because when you go into extension, it will close this gap. And if it closes the gap, what it can do is mild to moderate disc herniation. It can push that disc back in and relieve pressure from those nerves, thereby relieving your symptoms. Now, if you have severe disc herniation, that's a different story, because that will cause more pain. So if you do extension, it causes more pain. I want you to stop that and you see your specialist. Now, if you are in that extension category, meaning you find yourself arching back and the space have narrowed and that's what's causing the pain, what you want to do is you go the other way, go into flexion. Because once you go into flexion, you see the space here, you increase in space there. When you have that increase in space there, what it does, it also increases the space on the spinal canals. And if those spaces increases, you relieve the pressure on the spinal nerves. When you relieve the pressure on the nerves, and you guess it right, you relieve the symptoms as well. If you want to have an idea of the specific exercises that I have described for each of those categories, please check out my channel. I have those videos in there. There you have it, the simplified version of the possible causes of low back pain. Thank you very much for watching this video, and I hope you found value in what I have shared today. Please share this with others because most of us will have had back pain at some point in our lives. And don't forget to subscribe to our channel and click on that notification button so that you can get alerted once our new video comes out every week, helping you to get healthy and pain-free. In the meantime, go watch the next video.